Hi, everyone, and welcome to the Joyful Balance podcast. You're here with your host, I'm Mira, and I'm here with my co host, Denise. And we're going to be taking you on a journey all through your mind, your brain, and your body, and how all three things are interlinked. We're both together specialists in psychology, nutrition, and in neuroscience. So you're going to be getting the whole 360, all on brain health and nutrition from us. And so I'm going to hand over to my wonderful co-host, Denise.
Hi, everyone. So, as you can see, for those of you who see us on YouTube, we have another guest today, and we are super excited. So, today we have Dr. Nisa Aslam. She's a Hertfordshire GP here in the UK, and she has finished, obviously, her medicine degree, and she's been a practitioner for quite a long number of years. She's worked in hospitals as well as in community, and obviously as a GP for the local area in Hertfordshire and in private clinics. What we know is that as a general practitioner, she manages both acute illnesses as well as chronic ones. And today she's going to share us more of her knowledge, and we will be discussing more, medical kind of things and topics. Obviously, we are keeping it close to our bread and butter, which is neuroscience, psychology, nutrition. However, it might go into different areas. And that's just the
We've
beauty of our podcast.
we've been known to veer from our standard direction on occasion, but we promise we won't make it too difficult for you, Nisa.
So, welcome, Nisa. Thank you so much for agreeing to be our guest speaker today.
Thank you for having me. It's a pleasure to be on your lovely, joyful podcast.
Thanks. How are you doing?
Really good, thank you. Really, really good. And excited to have this conversation with you today.
Amazing. So how we're going to work today is that I'm going to start with the questions. So just in case podcast listeners think I've chucked Denise aside, I promise I haven't. But then Denise is going to come in with some questions to make sure that I certainly don't veer off too far track. And then we'll just keep this nice, free flowing and easy. I hope that all sounds good. Perfect. So Nisa, I was just really curious. Have you always been interested in kind of either for yourself or for your patients in healthy lifestyle, or is that kind of interest in living a healthy lifestyle, did that kind of come in later?
So I think it's an interesting question because you may assume that, being a doctor and having been a medical student, I would have always been interested in a healthy lifestyle. But actually, surprisingly, I didn't really know much about healthy lifestyle at all until I became a GP. So when I was at medical school, I feel it was very much a traditional model of teaching. So the way we sort of learned, we did a lot of science and physiology and pharmacology, which is amazing. And then in terms of managing patients, we learned how to identify disease and then how to treat with either a prescription, so a pill, or surgery. And what I felt that I didn't really learn because it wasn't in my curriculum was lifestyle medicine. Then I became a GP. I was working in central London at the time, and I realized that most of the long-term conditions that I was seeing and treating were due to lifestyle, so poor lifestyle choices. And that's when I started doing my own research and really learning to make changes for myself and my family, but also for my patients, because it was something that I was just not aware of. I had not been taught. It wasn't really covered that much in my GP training either. So it's a recent interest of mine, and it's certainly developing, and it's now become quite a passion and something that I'm working on every day for myself, for my family, and for my patients.
That's really interesting because actually that leads me very nicely onto one of my other questions, which is like, as a ballpark, I know you can't possibly give a super accurate figure, but what of the proportion of patients you see, what percentage would you say are kind of as a result of lifestyle practices that aren't geared towards being very healthy, that make up that the causes for the reason that people come in to see you?
So I think as you say, you can't really put a number on it, but what I would say is that most, if not all, of the non-communicable long-term diseases that I see are due to bad lifestyle. So, specifically diabetes, heart disease, vascular disease, stroke, osteoarthritis. That's a large sort of number of my cases that I see in clinic, and they are directly due to poor lifestyle choices. So, of course, if we address those and if we practice preventative medicine, we can stop patients from being in that position, and we can also ease the burden on the NHS.
Yeah, that's a huge one, isn't it? I mean, and just so in case our listeners aren't aware, would you mind clarifying what communicable and non-communicable diseases are?
Sure. So communicable diseases would be infectious disease. So, any type of infection, whether that's a chest infection, tuberculosis, chickenpox, COVID-19, those are communicable diseases. So those are not directly linked to your lifestyle, but non-communicable diseases that you don't catch from others. So they have, other ways of developing and other factors that play in.
Yeah, so that's a bit like as you were talking about diabetes, heart disease, osteoarthritis, as you mentioned, which curiously, why is it that Asians, and maybe because I'm also from an Asian background, why are we so predisposed to diabetes? Is it genetics?
So yes, so I think it's multifactorial. So certainly genetics comes into play, family history. I think that's a large part of it. And I think what doesn't help is perhaps our lifestyle. So particularly our food, it's quite rich in oil or ghee, or we fry a lot of our food. And I know that's a generalization and things are changing, but actually if you're from that part of the world, then our diets, we have a lot of parathas and biryanis and lots of delicious things, but that does not help when you're genetically predisposed to diabetes. And us Asians, we carry a lot of weight in our waistline, so central obesity, and that's really, really bad because you end up with visceral fat, and that's a disaster because then you're prone to diabetes, and then comes stroke, heart attack, kidney problems. So in answer to your question, we're genetically predisposed, and our lifestyles and the way we've eaten traditionally are certainly not helping.
Yeah, and I think that's really interesting because I promise I will get back to the schedule of questions because I can feel Denise panicking ever so slightly. No, okay,
no, not at all. I actually wanted to ask a follow up on that one.
Oh, okay, because what I've often heard when I've been training as a nutritionist, which is where my background is, as well as the neuroscience piece, is that genetics loads the gun, but it's the environment that pulls the trigger. And I think that's a really interesting, it's just an interesting saying that I've kind of picked up, which really rings true in that respect. But Denise, by all means, if you had a follow-up question, go for it.
I was just wondering, in regards to nutrition, not necessarily for the Asian community, but in general, and for people who might be predisposed to storing the fat around our midsection. Is there anything in specific that we should definitely consider to include in our diets, or to focus more in our diets in order to set ourselves up for success, rather than, I'm imagining a lot of fried everything is probably not our best friend, and I'm referring it in plural because I'm one of those people as well with the predisposed. That is my area where everything goes. So I was just wondering if you have any advice or any top tips that you could share with us. I know it's a little bit off the cuff and both of you can chip in.
Sure. I mean, I think if we don't focus on just a particular culture, but just generally, I think one of the things is sometimes nutrition has been made quite complicated. So there's lots of different diets and people get really wound up. And I think my aim is to make it really simple for my patients. So think about your plate, and then, I think make it half it. So half of it should be plant-based, so vegetables and salad. And then think about your carbohydrate. So it should be a natural carbohydrate. So potato, rice, for example, pasta, small portion. And then the other quarter should be your protein. So I think whatever culture you're from and whatever diet, whatever cooking style you have, you can do that. You can have your vegetable and salad on one side of the plate. It's really about portion control. And then your carbohydrates really shouldn't be bigger than the size of the palm of your hand. So I think that's one of the simple things that I like to say. I think it's hard to make dietary changes, but some things are so important. So, trying to cut down on sugary, high salt, processed food. It's not easy because our taste buds are now accustomed to these types of foods. Don't get rid of them all at once if you can't, but just try and cut down on those and try and get those vegetables and salad in instead. Okay, you might like chocolate. we all like chocolate. If you can't give it up, don't give it up. Just half the portion size to start off with, and then maybe think about swapping it for something like your dairy milk chocolate could become dark chocolate, or you might want to have dates. So I'm not going to go and do a whole nutrition course here, because actually it's not even my area of expertise. But I think it's about making small, consistent changes to your plate, and just starting to kind of analyze what's on your plate. And, there are a lot of cliche things that actually work. So make your plate colorful. So instead of beige foods, you should have some green and some red on that plate. I think kind of getting into that mentality that you're eating to be nourished and to derive energy. So think about whether you need that cupcake. Yes, it's fine to have a treat, and also think about, are you hungry or are you thirsty? Are you really hungry? You've had your meal. Could you drink some water? Because, most of our body is water. So is it that you've not had your 2 to 3 liters of water that day? So could you sip some water? And what I'm not saying is just stop eating, have some celery, and have some water. That's not what I'm saying at all. But I'm saying just do clever things, like have these little hacks to try and make those changes, so that overall you have this picture of better nutrition. And I think that's really hard. And it's about changing that mindset slowly, whatever culture you're from. There's so many things that you can do to tweak things so that you can enjoy your food and have a nice time, but be healthier.
Yeah, I would actually largely agree with pretty much everything Nisa said. Like, it's particularly around the portion sizes and the way that you think about your plate. So absolutely, and by naturally doing some of these things, and I mentioned in a previous episode, if you focus on more what you're including into your diet, you naturally leave less space in your tummy, literally, for the stuff that doesn't serve you as much. So, if you're suddenly, basing your meals around the vegetables that you're having, rather than worrying about what carb, and sometimes not necessarily is true for protein, but if you start thinking about what veg you're going to have first, and what protein, what carbs going to go with it, and by naturally putting half of that plate as salad and veg, and sometimes a bit of fruit, for example, in the morning or whatever, then you're naturally just getting a much better balance of nutrients. And with the whole colorful plate, you're just amping up all those beautiful antioxidants that you're going to get from your food, and plant based nutrients. You're going to lower your inflammation. That massively contributes to a sense of chronic disease. And all of these things, like, they don't, like Nisa said, I think it's so important that setting yourself up for this all or nothing, super restrictive diet often is a recipe for it to either not be successful at all, or almost more dangerously, and Nisa, you may or may not agree, is when you kind of yo-yo diet and you go on these like extremes of eating either way, where you're suddenly super restrictive or kind of binging, and that's a really unhealthy place for you to be in, I think, mentally and physically.
Absolutely, because you yo-yo diet and guilt creeps in, you feel demoralized. It's like a vicious circle. You either entirely give up, or you're just unhappy. And I don't think the aim of any diet should be to make you unhappy, because life is short. We should be loving our food. So it should be small, sustainable changes that you can make, that you can continue with.
Yeah, absolutely. Thank you both. That's what I mean, we've covered this in quite a few bits and pieces of episodes in the past, but it's just nice to put it together. That's why I jumped with a question. Sorry, Mira, I was derailing your thought a little bit.
No, I'm very glad you did, because I started the derailment in the first place. So I'm totally fine with that. I'm just having so as a next kind of question, when a patient comes to you that is in all likelihood has their problem that they're coming with, be it a problem with sleep or difficulty losing weight, whatever it may be, and you have a feeling or a sense that it could be lifestyle's a major contributing factor. I know that you're assuming that you're working within the NHS, your time is extraordinarily tight, right, in terms of the consultation time. So how do you start to broach that conversation around lifestyle changes in order to benefit someone's well-being? Because I know for sleep, my understanding is right now, for example, if you take sleep as an example, quite rightly, there's a lot more reluctance to prescribe sleeping tablets because of their addictive qualities Whereas there may be some simple lifestyle stuff, for example, putting down their phone at night, which might help them get to sleep faster. So I'm just really curious how you're able to kind of start to bring that kind of conversation in when you talk to patients, and also maybe how receptive they are to it.
So, I mean, time is short, as you'll always hear GPs say. And it's hard to do holistic lifestyle medicine in 10 minutes, isn't it? I suppose the beauty of being a GP is that you can have a kind of long-term professional relationship with your patients, so you can keep bringing them back. And I think there's a lot to be said about establishing a good rapport with your patient to start off with. So if they come in with hip pain, you might not want to jump in with a conversation about weight. But it's about actually that first appointment has to be about listening and being non-judgmental and being compassionate. And once you do that, you sort of earn trust and you can go into a partnership with the patient. And once that happens, actually, I feel naturally so many patients just open up to me and then they'll start asking me, you know, doctor, what can I do to lose weight? What can I do to sleep better? And so, you know, over the course of a few appointments, we can tackle things. And almost every patient is really, really receptive. So if you're non-judgmental, if you take the time to slow down, listen to them, break things down, not everyone has a science degree, not everyone can understand complicated terms. So, macros and ketones, and you don't need to do that. But I think just taking the time to understand your patient also, is that a housewife sitting in front of you? Is it a builder who's really busy? Is it a city worker? Just kind of analyzing each individual's holistic situation, then taking the time. And I think you can have a great dialogue with people and really, have a partnership and make changes with them and kind of go on this amazing journey, and you'll see changes, and patients will sometimes come back and they'll be so grateful. And some of my female patients will want to hug me because they've seen changes, and it's just really amazing, actually.
Yeah, I bet that must be super, super gratifying.
It's amazing. It's one of the best things about being a GP, actually.
Oh, that's really, really cool. And where do you think most, I mean, I suppose they're kind of almost obvious now that I think about it, but where do you see people, what are the top 3 things that you consistently see patients are kind of doing that are least helpful to their overall well-being? Like, if you could make them, you can either make them general or specific, it's entirely up to you, but if
So
we're saying, go for it.
So you want me to say the least unhelpful things in terms of diet?
The most unhelpful things in terms of diet or lifestyle?
I think sometimes people try to make one big, huge push and change when understandably they're desperate. I get that, because we've all felt low and desperate, but they try and make that huge push. It's really difficult, and then people give up, and that's you're setting yourself up for failure. Just slow down, take time, do small, consistent changes every day is what I say, and build them into your lifestyle. Because if you're a busy mom or a busy doctor or a busy builder, you may not be able to sustain that huge change. So I think the biggest thing that people do where they go wrong is they just try and do it all at once, and that doesn't work. I think the second thing is sleep. So where people are, especially in the UK, people are so overworked and stressed and busy. I feel like as a country, we're just always stressed. And so people, I think of sleep as a luxury. So it's like, I'm being naughty if I have a 7-hour sleep. But no, you're not. You need 7 hours of sleep to heal yourself, to recover your body and your mind. And I think people feel guilty sleeping. And that's where people go wrong, because you need to sleep and you need to have sleep hygiene in place so that you can sleep properly and have that great restorative sleep. So that's where people go wrong, because people think it's some luxury, you're lazy if you sleep, or, I should be surviving on 4 hours sleep and caffeine. So I think that's wrong. Well, not wrong, that's not a nice thing to say, but I think that's where people could do better, and, that's a disservice to themselves. The third thing, where do people go wrong? I suppose, again, perhaps it fits in with that busy lifestyle. We're so busy, people go for the short-term fix. So perhaps a takeaway or a meal from the supermarket or processed food, because short-term it's easier, right? You can feed your children quickly. you can do that and then get on with your job. Some people have evening jobs. And I think perhaps I can understand why people do it, but I think that perhaps you're going wrong, because in the short term, that's great. But in the long term, that's going to cause problems because you're taking in high levels of sugar and salt, and it's expensive. And I totally understand why busy mums would buy food from outside, like a pre-prepared meal. But I think trying to go back to what our grandmas did and buying those fruits and vegetables and cooking is an important thing. And I think we have lost that as a society to an extent. And I think if that could come back, maybe our lifestyles would be better.
Yeah, I think that's a really interesting point. Denise, did you have something you wanted to say?
I am so happy Nisa mentioned sleep. I'm just so happy.
We love sleep. Denise, we love sleep.
I know. And that's what I tell my clients all the time. It's like, this is not some sort of magical thing that only the rich and famous do. You need to sleep.
And it's so sad. It's so sad that it's so stigmatized. My goodness, I've had floods of tears saying, I feel lazy. My family thinks I'm lazy. All I want is 7 hours sleep. But that's your right as a human being. You need that to heal your mind, to heal your body, and if you don't sleep enough, you have higher chance of becoming obese. There are chronic conditions linked to lack of sleep. There is robust scientific evidence that if you don't sleep enough, you're at higher risk of depression, anxiety. There's some science linking it to things like ADHD and autism. There is some research which actually tells you, good quality research, that if you don't sleep enough for a long period of time, you will die earlier than your counterparts who sleep. So, there is no reason to not prioritize sleep. It's a beautiful thing that we need.
Yes, I think I'm absolutely with you 100%. But I think in this latest pop culture, hustle culture, whatever you want to call it, it's like, oh, it's fabulous. You have to go to bed at midnight, wake up at 3, do a run, do this, do that, and then, magically you're going to be so successful. And they link the lack of sleep to success.
Absolutely. And that has to change.
Yes. And maybe there are humans, I have no doubt there are humans out there who are able to go on with their life very successfully at a very small amount of sleep. But because it works for one individual doesn't mean it has to work for all of us.
Absolutely.
Speaking from my experience, give me 5 hours of sleep for 3 nights in a row, I'm dead. I don't.
Your mood may decline, and physically people get run down. I see patients coming down with infections. So sleep is key. You need to sleep. You need to eat well, and you need to sleep well.
Absolutely.
Yes.
Yeah.
We are the biggest fan of sleep, I think, in this circle.
We absolutely are.
I know it's difficult for parents, and obviously for Nisa, I should have mentioned this. Nisa is a beautiful mom of 3 children, so she has a very busy schedule with work and managing a young family. And I know it's difficult for some people to manage to sleep because, when you have a brand new baby, it's very demanding and so on. But just because that is an episode in your life, a fragment of your life for X amount of months or years, doesn't mean that once they grow up, you should feel guilty because you slept.
Absolutely. I completely agree. Absolutely.
That brings me on to a very interesting question, which was on my list of questions, which was, for you personally, Nisa, like what are some of the wellness practices, particularly as a mum of 3 young children, to like what are the practices that you have that make you or help you to feel really well in yourself?
So I am a busy mom of 3. I juggle my work and trying to look after my children. And what I found, particularly the more children I have, the less time I have. And I found that I was not making time for myself. So, we hear this thing about self-care, and is it a bit of a just, jargon that we use? But actually, I realized I had to make time for myself and practice what I preach to my patients. So what I do every single day to make myself feel good mentally and physically, I exercise. So I have to do, and I've said to myself, even if it's 10 minutes of cardiovascular exercise, I have to do it. But ideally about half an hour I do. And then I'm lucky enough to live in an area where there's lots of nature. So I try as much as I can to go on a walk. In fact, last night my toddler was having a little bit of a tantrum. She was very upset. And I said, let's hold mummy's hand. Let's go for a walk in nature. Let's calm down. And, physically touching trees and just being in nature. So I've really incorporated that into my lifestyle. I couldn't do that in central London, but it's so important to me. And actually, the third thing that I do, which is probably what most people love to do, is particularly after the pandemic, where we couldn't see our family, of spending time with my family and friends and reinforcing those positive connections is so important. So, it's so easy to WhatsApp people and use Facebook Messenger and Instagram and, God knows what other technology, but there's no substitute for real human contact. And I try and bring the family together so that we can spend time with each other, so that my children can learn the value of relationships, and that you learn that it's more than just a transaction on social media, because that's what life is about, right? That richness that you get from human connection. So to summarize, I exercise every day. I walk 10,000 steps every day.
Amazing.
And I try and make meaningful connections with family or friends, whether that's having friends over for lunch or spending time with my family. Those are the things that keep me grounded and keep me feeling good. Like I feel great when I do those things.
Which is really awesome. And I think, what's really striking in kind of the conversations that we're starting to have, and we can definitely keep this part going, it's that element of, I don't know how you feel about this, but it's this element of making really conscious decisions. So like you say, like you may not have time, especially with a demanding job and a young family, to like always do well, I was going to swear there, but I'm going to try not to, a lot of exercise, and that's okay. But the fact that you can consciously make time to say, I'm going to get outside and do my 10,000 steps, and I'll do like 10 minutes of weights, like that's
Absolutely.
amazing. And these are not like massive decisions where you're like, oh God, I have to be at the gym for 6 a.m. and I have to like be in there for an hour and I have to do this, that, and the other. It's like, it's almost these like I think we all, to do anything really massive feels so overwhelming and like so daunting. But I think when you break it down and you have this like 5-second pause to be like, okay, I can either choose the really easy option, or I can choose something that takes 5 extra seconds or 5 extra minutes, but is a much better overall long-term healthy option for me. It's finding that pause to try and pick that one, because immediately your brain wants to do the really easy, lazy thing. And that's just human nature. That's not the person listening to the podcast, me, you, or Denise, being, that we're just being human. But I think there's an element of just having those micro pauses that allow you space to really come to a conscious decision to choose something that's just that bit healthier, and all those small things incrementally will add up.
Absolutely. So when you say conscious decision, it's about planning a little bit. So just a little bit for planning. So rather than just living in the moment and just doing what's kind of hedonistic and what would feel good at the time, you just plan a little bit. Okay, after the kids have had their dinner, I'll go for a walk. Or actually, my husband works a busy job, so we were not seeing each other that much. And I thought, okay, a clever way of me spending time with him is we both do our 10,000 steps together. So we'll go for a walk when the sun goes down or as it's getting cooler, because, I can get my steps in and I can have a chat with him. So it's about kind of being quite sneaky and clever and just trying to think, how can I do two things? So kill two birds with one stone. How can I do that? Can I take my baby for a walk in the pushchair so she has a nice time and I can get my steps in? So I agree. It's overwhelming to think about, doing an hour in the gym at 5 a.m. But if you can do something fun instead, I think that's the key to success when it comes to a healthy lifestyle.
Totally. Like walking meetings, I mean, catching up with loved ones on a long walk, which is something that I think we're hopefully starting to become more accustomed to. It's maybe one of the benefits. Not that I would ever wish what's happened to us to have happened, but a positive outlook from COVID. I think that's really, really cool, actually, to kind of think, actually, there's a way that you can do, two really, really good, like really healthy things for you at once, and that don't feel super onerous. Maybe it's cooking with your family, for example, teaching
Absolutely.
your elder ones how to, chop ingredients and all sorts.
Absolutely.
Yeah.
Absolutely.
I think the key here is just starting small, as Nisa was saying a moment before. It's just for those of you guys listening, thinking, "Oh my God, I have to change completely my lifestyle." We would say, stop, breathe, don't do that. Start with one thing. Obviously, goals are fantastic, and that is something I think all of us in this virtual room today would be very keen on, and having a goal. But it doesn't have to be the only thing you see in your life, and then everything has to be changed completely. You can still have a goal, and then start with little steps. I think I always say the smaller the better, because they
Yeah.
become your habit, they become your everyday action, and then you do them without even thinking about it, like brushing your teeth, and by the time you realize it, it's already done. You walked whatever, 5 minutes, 10 minutes, however much you decided for that day, and then slowly and surely you can increment that, and you can add something more and something more, and in 365 days you'll be completely in a different place than you were 365 days prior.
Agreed.
Yeah, absolutely.
So baby steps.
Yeah, and that doesn't make what your achievements are any less valid. It actually makes them more powerful because you'll be able to sustain them for longer.
Absolutely.
Yeah. Okay, so here's an interesting question. What? So I have a background in nutrition and in neuroscience, and I kind of came to my journey through illness of my own. So I've had pretty bad anxiety and depression, and then had to start on a whole journey of wellness, and that's what really helped me recover. But so Nisa, another kind of question, kind of pivoting on from that, is I sort of discovered wellness as a result of illness that I had experienced myself, and we've kind of covered that in previous episodes. But you know sometimes what I see as someone who has experienced, so let's call it Western or modern medicine, but also works a lot with more natural methods or ways of healing. Do you ever find that there's conflict between the two in terms of perhaps what NICE, which is a National Institute of Clinical Excellence, I think, which is what the guidelines by which the NHS and doctors go by, versus what we know in terms of what works from a more natural diet and lifestyle perspective? Do the two ever clash when it comes to the advice that you give to clients, and how do you patients, sorry, and how do you kind of manage that conflict?
Sure. So the question, I suppose, is do the NHS guidelines clash with sort of lifestyle medicine, or using natural ways to treat people, I suppose, is the question.
Yeah, exactly.
I wouldn't say that they necessarily clash, the NHS guidelines, with lifestyle medicine, but I would say that the NICE guidelines are quite focused on identifying a medical condition and then treating it with a pill or surgery. And what I've always felt is missing is that step in between of, what alternatives does the patient have? So what else can they do before they are prescribed that tablet? So if someone has difficulty sleeping, do you look at the person holistically, or do you prescribe a sleeping pill? Now, I think in the past, the NICE guidelines were quite heavily focused on medication, but I can see a change, because I think we're realizing with this current healthcare model that it's not working. The NHS is under a lot of stress because of conditions that are due to poor lifestyle. And so I think there's acknowledgement that the guidelines have to change. So what that means is that they have to focus a lot more on preventative medicine. So rather than just having a guideline on medication to treat diabetes, you might start incorporating, lifestyle medicine, so preventative medicine. So that means, actually, I think that goes back to medical school. So medical students need to be taught this kind of new speciality almost of preventative medicine, lifestyle medicine. What does that actually mean? Because I didn't know that. I didn't know what it meant as a medical student or as a young doctor. So I'd kind of say to my patient, oh, and have a healthy lifestyle. But I didn't know what that entailed, right? So I think, coming back to your question, these NHS guidelines hopefully will evolve in the next few years, because they need to, so that we don't end up with this kind of overwhelmed healthcare system where we've got all these kind of diseases linked to lifestyle, and we're kind of throwing pills at them, but it's too late because, you know, what we should have done is practice preventative medicine and lifestyle medicine.
I think that, yeah, and you know what I was just thinking about as well, as I kind of asked that question, is I think it depends on what end of the spectrum that you're talking about, because, you know, if you think about, you know, you'll always get extremes where some feel that, you know, that the Western, you know, or modern medicine isn't really helping at all, and you should order it naturally, and then you'll have people that feel kind of the opposite. But actually, I think when you're looking at science, and science on the more like natural lifestyle elements is catching up to what we know about modern medicine, but that doesn't necessarily have to mean they clash. And, you know, certainly how I practice, how Denise practices, and obviously how you practice, is that we go by what scientific evidence we have. And so like, if you're grounded in science, it's actually very difficult for both of them to clash, I think.
I agree.
Yeah.
And actually, I mean, look, a lot of the modern medicines that we prescribe, so the opiates, digoxin, aspirin, they come from plants. So, you know, there's no denying of the healing power of plants. You can't go to the extreme and start treating serious medical conditions with just natural things, because that's also not right. But I think it's about incorporating lifestyle and preventative medicine into our healthcare system. And I think you're right. What we should be doing is advocating evidence-based lifestyle medicine.
Yeah.
So it should absolutely have robust evidence behind it. So the aim isn't to kind of say wish-washy, kind of airy-fairy things which don't have science behind them. They should have robust evidence behind them, and then you incorporate them into the kind of modern medicine that we're practicing. They should go hand in hand with prescriptions and tablets and surgery, because no denying you know, you can't deny the place of pills or medications, can you? But at the same time, I think it's just about kind of weaving in all this evidence that we now have about lifestyle and preventative medicine.
Totally. And you know, I think it's especially controversial, I think, when you're getting into kind of the more, I mean, it's controversial in all areas, but I think particularly when it comes to mental health, because, you know, correct me if I'm wrong, but the evidence regarding antidepressants is constantly being called into question now, I think more than ever. But for me, I think when I look at clients, because I tend to work mostly with clients who have a diagnosed mental health condition, namely more anxiety and depression. It's about also using lifestyle that means that you're on the least amount of medication that you need to be on, which is, you know, obviously a lot of medications, particularly ones that are for mood, can come with side effects. So it's kind of getting the best that basically out of both worlds. And that's not to say that medication, particularly for mental health, can't be life-saving. It absolutely can. But it's about, you know, where can we use lifestyle to the best advantage, you know, and therefore, you know, lessening the overall medical intervention you need, which hopefully is beneficial for you overall as an individual, right?
Absolutely. And I think as you talk about mental health, so if you look at the NICE guidelines, then actually NICE guidelines also advocate conservative measures and lifestyle changes for people who suffer from mental health conditions. So what the guidelines say is look at the person holistically, look at things like sleep, exercise, what they're eating, social support, and look at all of that before you start prescribing things like SSRIs. Personally, as a GP, despite all the headlines, I think SSRIs and antipsychotics are so valuable and life-saving. And I personally don't care what the headlines say. They have a place. They do work. But as you say, you can't just give pills in isolation. You have to support the patient as a whole. And that's what NICE says, that, you know, you need to think about talking therapies, and you need to think about sleep hygiene and exercise. And only once you've done that should you be thinking about, you know, giving a pill. So I'm completely with you on that.
I think it is indeed a stepped approach, as you were mentioning, particularly when it comes to mental health, because some maybe smaller changes would make a huge difference for that particular individual, and maybe it would not be needed to get to the SSRIs necessarily for them.
I agree.
if something else is identified and worked on.
Absolutely.
I just realized another question that and I will steal it from Mira's list, and I'm just asking it because I'm really keen on it, and that is about the connection between diet, lifestyle, mental health, and gut health. I personally believe there is a very, very important connection between what we have in our guts and how we are overall, in the sense of moods and how we feel and how we digest food. But I was just wondering if you see that as a connection, if you look at that from a medical point of view.
I mean, I think, there's that old saying that you are what you eat. And I never quite understood that when I was young. And actually now I understand it as I learn the science. And I think there's actually this emerging area of science now, which looks at gut neurology. Now, if we think about the gut, it's a structure which is full of millions of neurons. So our gut is actually our second brain, which is fascinating, right? Because when you're young, when you learn biology, you might think of it as just a tube that digests your food, but it's so much more than that. It has its own nervous system, which not only works with the brain, but works independently of the brain. So you can sever the vagus nerve and the gut will still work the nervous system. The other amazing thing is that we have serotonin, which controls our mood, memory, reward systems. So serotonin is essentially a neurotransmitter. And 90% of that is found in the gut. So isn't that amazing? So of course, what you eat is going to affect your mood, right? You have this thing called the gut-brain axis, which is the connection between your tummy or your gut and your brain. And actually scientists are still trying to unravel these connections. But it's very complex. There are so many layers to this. So on a basic level, you have the bacteria in your gut, in your tummy, the good bacteria, which we've all heard of. I think most of us have heard of. And what they do is they digest your food, as you say, but then they keep inflammation levels down in the body, which, that's really, really important in terms of preventing serious illness. And they also interact with kind of chemical messengers, which then link up to the brain and affect your mood. So essentially, the bacteria in your bowel have a huge impact on your mood. And there is evidence to say that if that bacteria is disrupted, then you are at higher risk of anxiety, depression, and other mental health conditions. So that bacteria connecting the brain and the gut, and then the nervous systems working together, there's no doubt that the gut and the brain are working in synergy, and they affect everything. They affect our nutrition, inflammation levels in the body, your risk of other conditions. So whether that's inflammatory conditions, whether that's immune system problems, whether that's your mood, anxiety. So you are what you eat, and what you put into your tummy will directly affect your mood. And we know that that's written in science now, and more science will come.
For sure. I think you're right, Nisa. We're still trying to discover so much, and the vagus nerve, and which is basically your super highway between your brain and your gut, in terms of it's this long nerve that runs through your body. I believe that actually there's more messages that go up from your gut to your brain than vice versa. So that just goes to show you just what power lies within the gut in terms of mental health. And now there's there's evidence that's coming out that certain dietary patterns, for example, the Mediterranean diet, as I have waxed lyrical about throughout the podcast, is actually shown to be particularly beneficial for people who have mental health conditions. And there's also this and maybe we can really quickly touch on this, Nisa, particularly your experience, but my understandings of research literature is also that there's a really big link between mental health conditions or having poor mental health when you have a condition like IBS and one exacerbating the other. I'm guessing you must come across that fairly routinely, I would have thought, in practice.
I mean, I think I don't know what the underlying mechanism is linking the two, but I suspect it is embedded in this gut-brain axis. So that's probably where the answer lies. But yes, I see it all the time. So there certainly seems to be a correlation with anxiety and, conditions that cause bowel spasms and irritable bowel syndrome. So they certainly seem to be going hand in hand. And I suspect the underlying cause for that is that there's this link between the gut and the brain through this axis that we've talked about.
Yeah, it's just to give some examples to our listeners of just how closely these two are interlinked, and by hopefully affecting certainly the way that all three of us work essentially is by affecting one of these systems, you can start to affect the other really positively and just bring about this overall sense of better well-being.
Absolutely. I mean, there's research going on in the area of schizophrenia and whether that's linked to gut health. And I think that's definitely an ongoing sort of area of research. But I think we'll find out more and more in the years to come. But there certainly seems to be robust evidence that gut health is linked to mental health conditions.
Is
Yeah.
that something? Sorry, Mira, to jump.
No, you go for it.
Is that something you maybe advocate to your patients when you see them with certain, appropriate conditions where you are questioning how well their gut is functioning? Is that something you talk to them and educate them, I guess?
I do, but not specifically where we still practice in this traditional model of medicine. So actually, to be honest, when you see patients, the focus generally is on mental health and talking therapies and medications. And actually, I have to admit, you don't really go into gut health that much because it's just not sort of in the way we're taught, or it's not in the guidelines. So you might loosely touch upon it, but actually I think if I started talking about gut health to some of my patients who suffer mental health problems, that they would look at me funny, because I think we haven't really made those connections yet. We're not used to talking even as clinicians about someone who's mentally suffering from a mental health condition and their gut. So I might touch upon it in terms of their lifestyle in general, but it's not necessarily something that we focus on in terms of a therapy as such. So it's just perhaps comes into the holistic picture. But I would say it probably doesn't get the attention that it deserves.
Yeah, I mean, like, especially when you're like, it's so tough in terms of time, but in the consultation. But actually, that leads me to another interesting question. I know I've seen it come up more and more, and maybe you can talk a bit more about it from your experience, Nisa. But with a lot of wellness practices, they can come across, at least on the face of it, really expensive. So gyms can be quite expensive, for example. Organic food, in the very least, can be quite pricey. There's always some sort of wellness gadget to be bought. Just look at Gwyneth Paltrow; she's worth billions, right? All off of wellness practices. Don't even get me started. I haven't got all the. We would be here forever. But when particularly, I think when you work in the community, what are what's your kind of top tips for low cost lifestyle, like for lifestyle improvements, would you say?
I think that 10,000 steps a day will cost you nothing. So get moving, and genuinely go with your family, go with your children, hold their hand. It's your time with them. Go with your partner. So you can walk for free. If you look at the NHS guidelines, when they talk about moderate or vigorous exercise, they actually lay out some of these things. So you could, bicycles I think are not that expensive. So you could go for a bike ride. In London, I think they have those bikes that you can,
the Boris bikes,
the Boris bikes, as we call them.
Yeah, maybe we should rename them, but you have the Boris bikes, things like lifting your shopping, the grocery bags, that counts as weight-bearing exercise. What else? Cycling, walking, running, gardening. So these things are free. Now, I think one of the things that I've heard a lot, and I can understand why people say it, is that eating healthy is expensive, doctor, and organic food is expensive, and I understand that, but I think you don't necessarily have to go organic, and you don't have to buy posh, interesting vegetables. I think I genuinely actually find eating out really expensive in the UK. So I really think that if you plan your meals, and it doesn't have to be fancy Nigella Lawson style meals, basic meals, plan them, scribble them, just make a rough plan, do your shopping in advance. So I think bulk buying and cooking can be affordable. And if you've planned your meal and recipe, then you're hopefully likely to have less wastage. And then, as a mum myself, and I'm trying to feed a family, I am aware of budget. So I'll try and do things like maybe buy frozen vegetables, because there's less wastage, or I'll buy tinned, canned fruit or vegetables because I know that it's less likely that they'll go off. So those kind of clever things to just plan your meals, I actually find is cheaper than, like feeding my family or with children for a meal out, because I find that quite expensive.
Oh
So
yeah, yeah.
yeah, so I think it's actually, it's okay. You can do free or cheap things to have a healthy lifestyle. And I'll tell you something else actually. So when I started becoming healthier, we made a decision as a family not to buy sweet treats, so no desserts or snacks or crisps. And my husband said to me, our grocery bill has gone down because we're not buying unnecessary things that we were just buying to snack on in the evening. So I think once you're slightly mindful and, as you said, kind of planning ahead and making conscious decisions, you can actually really buckle down on those costs. And it's really hard times. I have so much empathy for people. People are struggling to feed their families or heat their homes. So I definitely don't think we should be going around saying, have an organic Gwyneth Paltrow type posh diet. No, we have to have compassion and empathy and think about how can people feed themselves in the cheapest, healthiest way possible. And I do think that's through vegetables and frozen foods and bulk buying. And maybe that comes down to teaching children how to cook in schools. I think that is happening more and more in schools, but so that people have these life skills to buy food and to cook food and to store food, that kind of thing.
Totally. And there's a man who's made a lot of money from doing free YouTube workouts, like Joe Wicks. Like if you wanted to do something that was a bit more vigorous, or like you say, going out for a walk. I agree. Like, even as a nutritionist, I recognize that certain foods that are in the health food sector are really expensive and can be really out of budget. But actually, a lot of the stuff, it really doesn't, like fruits and vegetables are often the cheapest thing actually at the supermarket.
I agree.
And I tell you, the healthy food that costs the most is usually the processed stuff that is touted as healthy that actually really isn't.
I agree.
You're better off not buying it. Like similarly to your husband, I've decided that I was relying too much on those foods. As a nutritionist, I'm guilty. It happens to me too, right?
Absolutely.
And my last shop at a very bougie organic place that that's where I choose to, where I can luckily put some of my money. I just cut out those convenience food, and lo and behold, my bill actually went down.
Absolutely.
So yeah, I agree. Like it can, but even then, you can still use little hacks, like as you say, shopping frozen, bulk buying, all the things, like going later at night so you can get stuff that's reduced.
Absolutely.
There's all little things that you can do to try to bring that overall cost down.
I would tie one thing in as well, is the fact that I know for some of us, and some of you out there listening, you can imagine the cooking is laborious and is horrible and it takes forever and you don't know how to do it, and maybe you're intimidated by it. There are so many free recipes out there in the universe of 10-15 minutes or less.
Absolutely.
And just the fact that you can do something with your own hands from nothing, you make whole meal pasta with sauce, that will bring you joy.
Absolutely.
And you can't buy that.
No.
Yeah,
it's being creative, right? It's you creating something. And you don't need a fancy recipe book. Just if you have the internet, Google BBC Foods 15-minute recipe or Jamie Oliver's 15-minute recipe or 5-ingredient meal. I think keep it basic, because it's intimidating. It is intimidating trying to make a meal.
Yeah. And sometimes I find like let's take last night as an example. I went to go and babysit my niece, and I got home late, and on the way home, I mean, I luckily live with my parents. I phoned my mum and said, "Can you just boil me a couple of eggs?" And then I just made a salad when I got home, and I was like, I'm personally really happy with that, because it was late at night. It's warm outside. I didn't want to have personally a really big meal. That took me 10 minutes to put together. In the time that my eggs boiled, I had the salad ready, and it was job done. And so it doesn't have to be fussy. You can still really enjoy your food. You can absolutely create something. And actually going back to Nisa's point about like almost combining healthy habits, so that you're when you're doing it under time pressure, perhaps you can listen to a podcast, or like that's the time that you have away from your phone. If you have like the ingredients on your iPad or on your computer, and you're not on WhatsApp or whatever, like these are little like things that you can combine and make overall the whole process of cooking that much more enjoyable.
I agree. And actually, the only other thing I wanted to add is that when we think about healthy eating, then some of my patients ask me about sort of protein shakes and kind of liquid meals and things like that. And I think the issue is that they are expensive. And because you're drinking, you're not chewing. So that helps you with that. There's an issue with satiety, so you don't feel full. So you might be drinking this really posh, expensive meal, liquid meal, but you won't have that same benefit of feeling full. So I would say avoid like liquid meals because they might be expensive, and you're better off having something you can actually chew because it will make you feel fuller, and so and it will be cheaper.
Definitely.
And I think there's an element of being mindful of it as well, because as you're chewing it, you will have texture, you will you will produce saliva and everything else. If you are just downing some sort of protein shake, where is the texture?
Right. You need texture, you need to chew.
Yeah.
Your brain needs to understand that we're eating, and messages need to go through from your gut to your brain, and that might not happen with the expensive liquid meal. So that's another thing.
Absolutely.
Yeah, completely agree.
I was just nodding profusely earlier because I'm just like, no, I when I hear of this kind of liquid anything or detox, I just want to run in the opposite direction.
Absolutely. I mean, when I say liquids, like water, agua is your best friend, so have lots of it. It's amazing, but you don't need a liquid diet to be healthy.
Not remotely. No, definitely not.
This brings us very lovely and very nicely to the end of this episode. And I think before we close, is there any word of wisdom, Nisa, that you would like to share with people at large? Anything that maybe helped you and you think might help others?
I think I would summarize my words of wisdom as eat well, move more, sleep well. And I think my words of wisdom, if I sort of decipher that a little bit, eating well for some people, not all, means portion control. So if you think you need weight management, which sadly a lot of us in the UK, we do, if we're frank, we do. So portion sizes need to be discussed maybe with a nutritionist or GP. Maybe you eat less and eat more of the better food, because as Mira said, then you'll eat less of the bad stuff. So just try and have a little bit more vegetables and salads, and you may find yourself having less desserts. Sleep well. So think about sleep hygiene. So that means exercising in the day, winding down before bedtime, an hour before, getting your favorite book, having a shower, put the phone away, sleep well, get your lovely 7 hours. And I can't remember what the last thing was. Did I say drink lots or move a lot? So move. 10,000 steps a day is not that hard. If you go for a walk, if you do 10 minutes of any type of exercise that you like, then that will massively help you in terms of you'll feel good, you'll have so much energy, you may feel that you look good. That might be a huge boost. Spend time in nature, cherish your loved ones. So just WhatsApping them may not be enough. Hug them, see them. The pandemic has taught all of us the importance of that. So those are some of my words of wisdom. That's all about kind of feeling good. Wear SPF. We haven't gone there, but everyone wear SPF every day. Protects your skin from things like skin cancer and premature aging. I could go on and on, but I think in summary, make that conscious effort, as Mira said, to look after yourself, and small consistent changes. You can build on these small habits, make them part of your life so they don't become onerous, they don't become a chore, they are just kind of woven into your lifestyle. And I think it might mean that you have a happier, healthier life, which is what I want as an NHS GP for everyone, for my loved ones and for all of my patients. So those are my final words to you all.
They are perfect. Thank you.
Thank you so much, Nisa. Thank you for agreeing to...
Thank you. It was really lovely to speak with you both today.
It was our pleasure.
You're very kind. And we are very glad that you've agreed to come on and chat to us today. And also for all of you out there listening, just give us a follow, share our podcast with your loved ones or whomever you think might enjoy it. And if you have any feedback for us, or if you have any questions or anything you would like us to discuss in the next episodes, just let us know. We are here to
we'll make sure we'll also include Nisa's details so you can give her a follow too.
Yes, absolutely. We always do that.
Exactly.
Thank you.
Cool.
Thank you.
Take care, everyone.
Bye.